Okay, and I believe this presentation is being recorded. If anybody's uncomfortable with that, I can stop the recording. Otherwise, we can record it, and I'll save the file. I can make it available for all of you. I can't promise that will work because a lot of times email doesn't like the size of the file. So as an alternative, I can send these slides and then some of the pieces of material that we have associated with them to all of you. If you would like to put your email in the chat, that's fine. If not, don't worry about it. It's completely okay. Doesn't matter to me. I'll be happy to send materials as necessary. Hello, looks like we have Bill with us. Hello. All right, enough preface from my end. Let's get started. My name is Dan Milloy. I am the coordinator of volunteers for the Senior Medicare Patrol, or the SMP, at CARIE, which is the Center for the Rights and the Interests of the Elderly, located in Center City, Philadelphia. So we'll start here. I'll be talking mostly about Medicare fraud, or really Medicare fraud prevention. But I will briefly cover some of CARIE's services. Back on June 1st, I did a presentation with Scott Kuhn, just a little bit more in depth about CARIE and the services that you see here on this slide. But for the purpose of this presentation, I'll be rather brief here. So with that, CARIE was started back in 1977 as a 501c3 nonprofit, and we've been operating as such ever since. The flagship program, the CARIE line, is really a one-stop shop. It's a hotline for really, truly any issue related to aging. A lot of what we deal with is transportation, which is TSAP, Transportation Assistance Program, CHC, Community Health Choices, which is Medicare and Medicaid dual enrollment, and a prize, which I should mention has changed its name recently. It is now PA Medi. Don't ask me what it means or why they changed it. I have no idea, but they did. This program I'll talk about in a brief moment, and utility assistance, which this time of year, as I mentioned, griping about the heat, not everybody has access to AC. I know quite a luxurious comfort on days like today. Likewise, in the winter, many folks, especially those falling under certain income thresholds, may not have the ability to pay for heating or oil. So our programs can assist people, connecting them to different resources in their regions to get those utilities turned on. Before I actually get into more details here, I will say CARIE actually services the entire state of Pennsylvania. In reality, we service the entire country. I know I've heard of cases actually related to transportation from both Seattle and Milwaukee that our advocate Karen Chenoweth worked with consumers to get them hooked up with rides to and from appointments during the pandemic, 1,500, 3,000 miles away. So most of you, I'm assuming, are probably in Bucks, or at least in that area. We certainly do service that region. So again, TSAP is transportation. Community health choices, what our advocates do for community health choices is help folks get enrolled in the program. Again, it's mostly dual eligible beneficiaries, those who qualify for Medicare, but also Medicaid here in the state of Pennsylvania. Several years ago, the state decided that it might be a good idea to partner with some of the managed care organizations to administer the special help and special needs plans under the state Medicaid program. It's a good idea. It's a lot of coordination efforts that are being transitioned elsewhere to organizations that may have more resources available in the state itself. However, it's very difficult to get enrolled. It's very difficult to stay enrolled. So I can tell you, I spent a lot of money on my education in healthcare administration, a couple different degrees. I can't wrap my little head around this program. So CHC, Community Health Choices, is there's quite a robust amount of information in there, likewise with the amount of services they offer. But I really do just want to emphasize, if any of you or anybody who you know is seeking dual eligibility, Medicare and Medicaid, please do contact CARIE and ask about community health choices. Most people who try to enroll by themselves are unsuccessful. So our advocate, David Johnson, is actually the supervisor of our CARIE Line program, knows the ins and outs of this program better than anybody else who I know. So I would highly recommend that program for assistance. The prize, as I mentioned, is now PA Medi. This is free, unbiased Medicare insurance counseling. Each year, October 15th through December 7th is the open enrollment period when folks, Medicare beneficiaries, or those who are new to the program, can take a look at what options exist, whether that be traditional Medicare, Medicare supplement plans, Medicare Advantage plans, Part D prescription drugs. Again, spent a lot of money on my education. I still can't wrap my head around how much goes into Medicare. So this program, the advocates are very highly trained, very specially trained, and they will actually do a one-on-one meeting with the beneficiary to look through what services and needs that beneficiary has. And then they'll look and see what plans might be the most appropriate. This program does also exist year-round, and they do take appointments all year. There's something called special enrollment. Again, the details are a little bit too gritty for this presentation, but if you have any questions about your Medicare or what options might be available to you, I highly recommend the APRISE program. You can contact APRISE in Bucks County. I believe it's administered through the Area Agency on Aging. Already talked about utilities, so I'm going to slide down to the PAVE program and speak a little bit more quickly about the next two. PAVE stands for Providing Advocacy for Victimized Elders. It's a victim assistance program for adults over 60 in Philadelphia. While CARIE does service the whole state and the country, this program in particular is a little bit more specific to Philadelphia County. However, our advocates do happen to be rather in the know with other agencies around. So they would be happy and more than qualified to connect folks to the appropriate resources in their regions. Unfortunately, we see a lot of compounding issues in the state of Pennsylvania between the opioid crisis and elder abuse. It does happen. It's not a pretty thing to talk about. However, older adults do fall victim to financial, physical, and emotional abuse. When these situations occur, it can be very distressing, and oftentimes it's a relative who is perpetrating the abuse. Typically, a grandparent is the victim, and that person, more often than not, doesn't want to take a loved one to criminal court. So it lands in family court. Our advocates exist just to ensure that older adults don't have to endure that situation alone. They will actually act as liaisons between the district attorney's office, the police, and the victim, and actually, in certain circumstances, the abuser as well. The Ombudsman program is very interesting, very important program. Again, a little bit difficult to talk about because of the effects of the pandemic on folks residing in residential care facilities. But at any rate, the Ombudsman are advocates for folks who reside in long-term care institutions, typically nursing homes, assisted living, and personal care facilities. Situations arise all the time. People have complaints. Before the pandemic, a lot of it was smoking related. I want to smoke and my roommate's not cool with that, or the food's no good. Sadly, it's become a little bit more severe. There are a lot of discharge and admission issues, quality of care problems related to the pandemic and lack of staffing. While the Ombudsman program that CARIE administers is only in Philadelphia County, we do also now sponsor the Montgomery County Ombudsman program. But there is an Ombudsman in every single county, all 67 counties of Pennsylvania. Our advocates also work very closely with the state ombudsman, advocating for rights for those living in facilities. Excuse me. So all sorts of situations arise. It's an important program. If you know anybody or you yourself reside in a long-term care institution, have any questions or issues that need resolution, the ombudsman are the people to call. All right. A lot of info, speaking quickly there, but I will move forward to the Medicare fraud piece, which is really why we're here. All right, so the SMP, Senior Medicare Patrol. National initiative dedicated to curbing fraud and abuse in Medicare. and a wee bit in Medicaid, but we mostly focus on Medicare. There's an SMP in all 50 states, the District of Columbia, Guam, Puerto Rico, the U.S. Virgin Islands, many different SMP stations, and they all function the same way. We all recruit and train volunteers who typically are Medicare beneficiaries to teach their peers how to spot fraud and truly what to do about it. The primary message and what I always like to focus on in these presentations is we're a program of empowerment. We really want older adults, families, and caregivers, and Medicare beneficiaries in particular, to understand that they matter and that their health care is theirs, and you have every right in the world to care about it, and you should be paying attention. So we'll go through this presentation. As we go through, there will be several pieces of information that I'll provide and talk about that will kind of reiterate that fact. All right, again, our goals: educate and motivate consumers on how to prevent, detect, and report healthcare fraud, errors, and abuse. We do this through presentations like this. We also do a lot of media and print outreach on TV, radio, and via hard copies to our partners at legislative offices and other civic organizations across the state. We also have a piece where we will receive, investigate, and refer complaints of potential healthcare fraud. All right. It's all fine and dandy, but why do we care? Why does this matter? Well, we should definitely care because we all, as taxpayers, have paid into the Medicare program. Some of you, and I'm sure all of us, know many people who are enrolled in the Medicare program. So of course, that's a little bit more of a direct importance. Bottom line here is that Medicare loses a ton of money to fraud. We're talking 60 to 90 billion, billion with a B. Each year the fraud is lost. Now, I always say, I will never see $1 million in my life, let alone $1 billion. And then you take that, multiply it by 90. I can never conceptualize that amount of money. I currently live in South Philadelphia, where it's about 100 degrees. But anyway, 1.5 miles down the road from me is Citizens Bank Park, where the Phillies play. That stadium cost roughly $500 million to build. So in theory, you could build approximately 120 to 150 Major League Baseball stadiums every single year with the amount of money that Medicare loses to fraud. It's a lot of money. It's a lot of money, and it has tangible effects. At the bottom, you'll see how this impacts Medicare beneficiaries. Higher deductibles and premiums. Every single year, the deductibles go up. The premiums go up. They're actually over Part B premiums over $200 this year. I mean, every single year, these things go up, and a lot of that is due to the amount of abuse, waste, and fraud that occurs. As such, there's less money for needed benefits. I hear a lot. Why does Medicare not cover X, Y, and Z, especially eye care and hearing? Well, maybe if we weren't hemorrhaging close to $100 billion a year to fraud, Medicare could potentially cover those services. Decreased quality of treatment. Again, it's a tangible effect here. Beneficiaries, actually, there's a study in the Journal of American Medicine back in October of 2019, which feels like forever ago, but at any rate, this study showed that beneficiaries who received care from providers who were later convicted of Medicare fraud actually had a 14 to 17 times higher likelihood of succumbing to all-cause mortality. So there are real effects here. Medical identity theft, has financial and truly personal issues. If any of your information gets compromised, there could be issues that arise. We'll get into that a bit too. Quickly here, I'd like to delineate between fraud, abuse, and errors. They are different, they are very similar, but there are some key markers that identify them between themselves. So fraud really is just intent. If a person is intentionally billing Medicare for things that didn't happen, that's fraud. In my mind, abuse is a type of fraud. It really is. Providers maybe providing services to a certain extent, but billing for more than what was actually provided. It's an abusive practice, but to me, there's probably some intent there. The bottom one, errors. As far as I'm concerned and aware, Errors are probably where the majority of the money is being lost. Healthcare billing is really complicated. It's also insanely boring. Trust me, I had to do it in a former job. It's very boring, to me at least. But it's really complicated. There are thousands of codes, thousands of modifiers, and all sorts of different pieces that fit into getting a claim from the time you receive service to getting it paid. That revenue cycle is really complex and mistakes do happen. All right. So what do we do about it? What do we advocate? On the SMP, again, we follow protect, detect, and report. Keep your healthcare, personal, financial information private, please. That is your information. That includes your Medicare number. That includes your social security number, your credit cards, and your date of birth. Believe it or not, date of birth is the #1 identifying piece of information for all sorts of different I guess, agencies or programs. That's truly the strongest way to identify a person. If you receive any calls, emails, text messages, or come across anybody in public who is asking for any of these pieces of information, it is 110% a scam every single time. Do not respond to anybody who is cold calling you out of the blue. If you didn't initiate the contact, it's likely a scam. Medicare and Social Security, as much as I would love to tell you that they care enough about you to call and check up, they don't. They don't have the resources, they don't have the money, and they certainly don't have the time. So anybody claiming to be from a government agency is lying to you. So again, protect your information, keep it to yourself. We always advocate, if you do need a service or you have questions about your healthcare, talk to your primary care physician or any other trusted medical provider. All right, detect. This is a big one. It's very simple, but it's a very important piece of the puzzle here. You can spot scams by keeping a record and comparing them to your billing statements at the end of the reporting period. If you are on traditional Medicare, you will receive a Medicare summary notice at the end of every quarter. If you are on a Medicare Advantage plan or any commercial insurance plan, you will receive an explanation of benefits either at the end of the month or after services are rendered. You will know what that document is because in big bold letters in the front, they slap, "This is not a bill." Whether you want to look at that document or not, I urge you to look at it, but please, regardless, shred that document. Do not just throw that in the trash. It has your social security number on it, it has your Medicare number on it, it has your date of birth on it, and it has the providers who you've seen in the past several other days, weeks, or months. Those are all very, very important pieces of information that you don't want people getting their hands on. So if you're not going to look at it, shred it. If you are going to look at it, and I implore you to do so, take a look and compare it to records that you keep. Those records are very simple. It's 3 pieces of information. Bring a little piece of paper and a pen with you when you go to see a provider. Jot down the date, the name of the provider, and whatever service was offered or rendered. So if you go to see your primary care physician for your Medicare annual visit, you would write down June, I don't even know what day today is, 29th or 30th, something like that. 29th, I think. June 29th, I saw Dr. So-and-so, and he provided me with my Medicare annual visit. You do that so that at the end of, when you go to compare it to your statements, you can look for inconsistencies. We're looking for dates that are wrong, provider names that are incorrect or you do not recognize, and services that may or may not have happened. If you notice inconsistencies, remember, we are a program of empowerment. You, as beneficiaries or as folks who receive healthcare services, have every right to question your provider. If you're not sure about the charges on your Medicare summary notice or your explanation of benefits, give a call over to the doctor's office. Not to accuse that person of being fraudulent, but just to ask about the charges. Hey, do you mind verifying this information? It doesn't add up with my records. You know, maybe there was a mistake that was made. Oftentimes, billing departments or providers are happy to work with beneficiaries. If you don't have much success in that realm, you can give a call to your Medicare Advantage plan or 1-800-MEDICARE, or you can give CARIE a call and we'd be happy to help. that number will be provided at the end. That's where report comes in. Give us a call, give Medicare a call. If you do feel like you've fallen victim to a scam, give us a call at the SMP at CARIE's main number. It's free, it's confidential. We are very, very happy to help. We actually have direct lines through to Medicare, so you don't got to wait 35 minutes on hold. We give them a little identifying information, and they would be happy to keep a record of your case and send a new Medicare number if needed. All right. So here's the little piece about the Medicare summary notice. You can see I circled in red. This is not a bill. Please take a look at these notices or your explanation of benefits. Anybody who's computer savvy feels comfortable putting information on the computer, you can sign up on medicare.gov for a free account. Your information will upload a little bit more quickly that way. All right, grab some more water because it's so unbelievably hot. All right, some examples here of fraud and abuse. I won't read through all of these because I'm sure you're all capable of doing that, but billing for services and supplies that were not provided, or billing for services that were unnecessary. This happens a lot. This happens in podiatry. There's a case out of Delaware County not too long ago. There was a podiatrist who was trimming toenails. Just taking a little nail clipper, trimming some toenails. However, he thought, maybe he would be a little bit sneaky and start billing Medicare for surgical removal of toenails, which runs several hundred, if not thousands of dollars more. Got away with it for a little bit until beneficiaries started to look at their Medicare summary notices and realized that it's a little bit curious that this doctor who just trimmed my nails is billing for the same toenail removal every single month for the last 6 months. My toenails don't grow back that quickly. I'm sure yours don't either. Just took a handful of beneficiaries to report it for the feds to start looking into it. That provider is now serving time in federal prison. So there is a purpose to checking the statements to look for things like this. Now, that's called upcoding. It's a form of abuse, which again, to me, is a form of frauds. So take a look, be careful for that happening. It does happen a lot. Okay, requesting personal, financial, or medical information in exchange for quote unquote free services. Nothing is free. Absolutely nothing is free. If a person is calling you saying that they can give you a free back brace, it's not free because Medicare is paying for it. And we'll get into that in a second because I'll cover that at the bottom of the slide. But just be very wary of the word free. Again, don't engage with these folks. If anybody's offering you free services, hang up. If you're interested in the service they offered, give a call to your primary care physician and ask that provider. Improper coding we talked about already. So let's hop down to the bottom and talk about some of these fraud schemes. And I will preface all three of those little check marks at the bottom by briefly describing how these schemes work. We'll use a phone call, a cold call, a scam call as an example, because I've already gotten like 3 or 4 of them today about my car's quote unquote extended warranty, which I can guarantee you my car does not have an extended warranty. I'm sure you guys have all received scam calls, but anyway. Typically how it works is a marketing agency or a telemarketing agency will give a call to a beneficiary. They will try to solicit information off that beneficiary, try to get the Medicare number. That's the number one piece they want. They want your Medicare number and they want your date of birth. If you give up those 2 pieces of information, then they have it. What they do with that then is they will work with, depending on the scheme, if it's genetic testing, they'll work with a laboratory. If it's durable medical equipment, back braces, knee braces, wheelchairs, they'll work with an equipment company. And then in between the scheme are telehealth physicians who are typically certified in multiple states. So the process is the scammer calls, gets the Medicare number and date of birth, sends it over to the telehealth physician who will certify and write the order for the genetic test or the back brace, knee brace, whatever it may be. Then either the lab or the medical device company will bill Medicare for that piece of equipment or that service. When Medicare pays it out to the lab or to the device company, they will issue kickbacks to that telehealth physician and the marketing company. That's how the schemes work. Keep in mind, however, there's a very strong undercurrent here that often flies under the radar. If these scammers have your Medicare number and if they have your date of birth, I can bet every single penny to my name that they have sold that 100 times over to everybody else who they know. A single Medicare number goes for about $500. So even if a scammer gets a claim denied from Medicare, that scammer can still sell your information off to other scammers and still make a profit on you. So be very, very careful. I don't want to scare anybody. It's just these are real world examples of things that do happen every single day. So it's important to keep your information private. Okay. COVID scams work the same exact way. We saw it with personal protective equipment, masks and gloves and whatnot. We saw it with contact tracing, people pretending to be contact tracers, but they actually were not. And then the vaccines came out. People were saying, hey, pay us $100 and give us your Medicare number, and we'll put you number one in the line to get a vaccine. Not true. Also, the most recent one, if you've been vaccinated, it's pretty unbelievable. There were scammers sending fake surveys to people via email and text message with links in them. If you click on that link, that will download all sorts of stuff onto your device. And the purpose of that, it's called malware. The purpose of it is to get your information off of your computer. So be careful. If you see any text messages or emails from persons you don't recognize and there are links in there, don't click on those links because you just want to protect yourself. You never know. It's quite alarming. So the vaccine, at this point, we're moving pretty far along the vaccine timeline. But again, if you haven't been vaccinated yet or know anybody who's interested in receiving a vaccine, just be wary of anything being offered for free. I would recommend getting a vaccine through a trusted healthcare provider. Okay, that is really the basis of what I have here. Here's all of our contact information. And again, I would be happy to share this broadly as needed. I will say real quickly, again, one of our volunteers, Scott Kuhn, was supposed to be joining me today, and he had asked me to talk about an abuse case that we had, but without Scott here, I don't really want to do that just because this is really supposed to be his presentation. I'm sure he'll be interested in doing another one of these at some point. So I'm going to save that piece. I don't want to scare anybody further than I probably already have. Okay, pull off the slides and open for discussion. Provide a review if needed for anybody who joined a little bit later. I can answer any questions, discuss cases, or if nobody has questions, comments, or concerns, we can hang it up and go sit in front of our air conditioners. Melissa,
I have a question. So I have friends whose elderly mother lives in Philadelphia, but all her children reside in other states. So I'm just wondering about their being able to contact CARIE or Apprise or whatever and act on her behalf, because I don't know how cognizant she is and able to help herself. Is there any issues with that, or is there anything they need, identification they need to provide so that it will all go smoothly with it when they try to contact people?
A little bit of a yes and no. Bottom line is, yeah, CARIE would be happy to help, especially with family members and children of an older adult. It definitely helps if the information is ready. They'll probably ask for name, date of birth, and address. And it certainly helps if that older adult, his or herself, is able to be on the line to verify that he or she wants to, or is basically giving verbal permission for somebody else to be on the line. But yeah, our advocates work with families and caregivers all the time, all the time.
Okay, great. Thank you.
Any other questions related to fraud or CARIE in general? If we're all covered up here, then let me grab. Let's still grab your email. If anybody else would like a copy of the slides or any of our other materials via email, you can send me a private chat or put a message in the chat here. And I'll be happy to send you that information. If not, it's totally fine. You can find us online, www.carie.org. And again, toll free. It's funny because I always laugh to myself. These are the things that make me laugh. It's unbelievable. During presentations, I always say, nothing is free. Don't trust anybody saying anything is free. And then at the end, I say, call CARIE because it's free and also confidential. But it truly is. We are a federally certified 501c3 nonprofit. We're acting in your best interest. But that always makes me chuckle. Okay. If there's nothing else, I will close it off and I'll go about our merry little evenings.
Okay. Thank you so much, Dan. I really appreciate your giving us all this really great information, and I'll be sure to share it with folks.
Wonderful. Yeah. Thank you so much. Thank you all for the attention and for being here. Appreciate it. Take care, everybody. Stay safe. Stay cool. Cheers.
Thanks.